Hi, I'm Dr. Som, a board-certified plastic and reconstructive surgeon, and today we're going to discuss Brazilian butt lifts, otherwise known as buttock augmentation. So traditionally, buttock augmentation used to be performed with implants, in particular silicone implants. So even before that, people were doing silicone injections directly into the buttocks as well as into the musculature, which creates a whole host of problems and issues with people requiring massive reconstruction, as most people have heard of and seen on shows like Botched and things like that. Those are the wrong ways to do buttock augmentation. Now, with advance of time and technology and skills and understanding and learning, most commonly people use fat, which is the most traditional form of Brazilian butt lift or buttock augmentation. How do we get this fat? We start out by doing liposuction, whether it's from the stomach or the thighs or the back. We harvest that amount of fat that we need through liposuction techniques, and then we take that fat and we re-inject it into the areas of the buttock that are needed to get a good lift. Now, commonly one of the other things that we will do to combine for an improved outcome is we will go in and on the lower back, really work aggressively to contour this area and create a better look. How do we do that? We really aggressively focus on liposuction in these areas to create an even more accentuated look. So minimizing any fat in this area and then really coming in and adding to the buttocks to get a nice lifted look. Now, buttock augmentation and the different shapes that we look for when we talk about and discuss buttock augmentation, there are really three classic patterns of buttock shape. One is the classic A shape, the other is an H, and then there's the inverted A or a V, obviously. This is the non-ideal is an H. However, the A or V are both desired looks, and that's based on patient preference and desire. Most, if you're looking for a more lifted look, will go with the V. However, other people that may want a more accentuated look will go with an A pattern. The pattern doesn't change the technique. We still go in and do fat grafting and liposuction to help create that contouring. However, one important thing, whether you come to us or anyone else, you want to make sure they know the procedure and technique when they're fat grafting. Over the last couple of years, there have been significant numbers of deaths from fat grafting to the buttocks. So there was a ban made not only nationwide, but internationally on this procedure, because what was happening were people that were not well versed in the technique were actually injecting fat into the muscle. And when you inject fat into the muscle, there's a lot of blood vessels. That fat was going up into the bloodstream, creating blood clots in the lungs, and people were dying. So that is the wrong way to do it. Typically, when we want to do fat grafting to any area, we do not want to inject into muscle. So we try to stay, if here is our muscle and the buttock muscles are the largest in our bodies, you want to stay outside of that in the fatty area to create a better shape as well as not kill someone. So please make sure you're going to a board-certified surgeon that knows and has experience not only with the procedure, dealing with the complications that can occur. So if your loved one is interested, contact us either in person or via email. I'm Dr. Som, and we're here for you.